What is your approach to reducing healthcare costs and also providing coverage for all?
Approach? Well, let me start with providing coverage for all. You know, right now, I'm running for office, and I don't have health insurance. I had to take a leave of absence from my company to do this, and my health insurance expired. I believe that was a risk that I wanted to take, that my family took. It was a big risk, but nobody is guaranteeing me health insurance. I could, if I wanted to, I could pay more to cover it, but I couldn't afford it. So I won't have health insurance for several months. You know, unfortunately, health insurance is not a right granted in the Constitution. You know, I don't have a solution to give health insurance to everybody. You know, my hope is that we can remove government regulations so that businesses can expand and thrive and people can get a good job in order to afford to buy health insurance. But I don't believe that it's the government's role to provide health insurance to everyone. Now, how do we reduce healthcare costs? One of the issues, and a big issue, especially for states like California, is dealing with the illegal immigration problem. We have so many births in the US, so many emergency room visits from illegal aliens. We need to stop that. If we can reduce the illegal immigration issue, that will significantly cut back on healthcare costs. So, thank you.
I agree. Healthcare in America isn't a right, it's a responsibility. When Kathy and I adopted our two little boys, we tried for many years to get pregnant, had no luck. One of the reasons we're pro-life is two moms chose life, and now we have a family. But when we adopted them, we didn't go around to our neighbors and say, hey, can I get some money for gas? I get money for health care. Can you pitch in for some clothes? We knew what we were taking on, just as every one of you as parents knows that's your responsibility. That's why I fought so hard and take a leading role fighting against the government takeover. And many of you, thankfully, and I appreciate, have said thank you for developing that chart that showed just how complex and bureaucratic that healthcare takeover bill, and that has helped stop that bill in its track. You've heard me talk about this. Coverage, affordability, responsibility, and efficiency. I've introduced legislation along with Representative Paul Ryan to squeeze the cost out of healthcare, lawsuit abuse, lawsuit reform, which can save us $100 billion a year. Squeezing the fraud and abuse out of the system, which adds so much to it. Creating coverage. The people who are don't have health care, they work for a small business that have under 10 employees and can't afford it. They're in between jobs, often because their spouse has moved, or they have a pre-existing illness, cancer, diabetes. We're suggesting a worker backpack where people can choose health care, get the same tax breaks businesses, take it with them from job to job throughout their life so they own their health care. We need to pull back the curtain of mystery on pricing so you and I can choose the health care that's affordable to us. There's some great ideas Republicans have offered. I started on health care many years ago. We've got some great bills. If this president will scrap that plan and go back to the drawing board.
Yeah. Illegal immigration is absolutely one of the solutions that we have to deal with, because that will help bring down costs, because our hospitals are flooded with people that don't have any insurance and are here illegally. That will actually bring down costs. Lawsuit abuse reform. We've known for 25 years that's first thing on the list. The Republicans last year took 10 months to make a health care reform bill. 10 months. We've known about this for at least 25 years. Most of these issues have been coming for 25 years. It doesn't take 10 months to put something together. It's easy to answer these questions. We know the problems. We know the problems, and we understand the solutions. We know it has to be done, and that's opening up the free market. You know where healthcare is most effective right now? It has nothing to do with health. Botox and cosmetic surgery, because insurance doesn't cover it. So the prices go down because there's a free market right there. We have examples right in front of us of what works. That's what we need to do. We take things that we know work. That's how we move forward. Texas in 2003 instituted lawsuit abuse reform. It's been effective. It's not a magic wand. It doesn't solve all the problems. Can we cover everybody? It's not the government's job to cover everybody is the first problem. with that question. The government does not belong covering every citizen. There's always going to be people that fall through the cracks. That's unfortunate but true, that are between. And really the difficulty of covering right now is not the welfare state recipients. It's actually the working poor, the people who just don't make enough money to afford health insurance, but they make too much to get any kind of government assistance. There's some gray area in there that people fall under. They just can't afford it. What can we do? Get the government out of the way so we can get these costs down with lawsuit abuse reform. There's a proposal right now called that they've ignored in Congress. It's called a refundable tax credit. And it means you own your insurance and your employer buys into it. You get a tax credit so you can afford your own insurance. That's a way to start down that road. Eventually, the government should just step back and get the taxes low enough so they don't have to give you a credit. The money stays in your pocket. You buy the health insurance that you need, and it's yours.
You know, I was spending some time this summer when Congressman Brady came back and doing all of his healthcare town halls. I loved seeing that chart that the Joint Economic Committee, his staffers, put together. But I offered my own chart, and I think it's my favorite thing I've ever seen. I would like to offer it as almost an amendment to his chart. And it had 2 boxes on it. It had doctor and patient. And that was it. And the line connected, and that way doctors and patients could just be together. Now, how does that work? It's free markets. It's the free markets that drive everything. In Texas, we have on the order of about 45 insurance companies that we can buy insurance from, but there's 2,000 in the United States. Why don't we have access to those insurance companies? Why can't we get their policies here in Texas so we have more competition? You know, I like the idea of being able to go a la carte on your insurance program. I like the idea of knowing how much I'm paying for certain kinds of coverage, because if my wife and I don't want to pay for fertility treatments, then why is that a part of my insurance policy? Why am I paying more for that when I don't really want it at all? And these are all things that within the state and the federal government we can address this election. We just need to get the government out. That is a common theme here. Get the government out, and we can solve the problem today. I think that the solution will be difficult. I think that it's going to take some debate and some discussion in Congress, but I think it's something that we could do. And as a district, we need to get together and endorse the free markets, and we will all be winners.